Wanyama in Eldoret, Uasin County, wants to briefly update us on the Moi University Technology Students Association Expo 2018. And in particular, he will be focusing on an invention there, an implantable device which has the capacity to deliver medication to patients for a prolonged duration of time. Let me now bring in John Wanyama for that update. I can see you already at that particular function. Good morning, John Wanyama. Just tell us a little bit about some of the innovations there.
A very good morning to you, Wahiga, and indeed at Moi University main campus here in KSS. And clearly, as you've said, today Moi University students they are having more than 60 innovations, and they are going to display them around today. And there are some few innovations, Wahiga, that I would like to take you through, maybe if time allows. And maybe if I can start here quickly, Wahiga, we have these young men here who are trying to do something here. Maybe we are just seeing a lot of cables here. What are you doing here exactly?
Okay, so
you can face the camera.
Okay, so our project is about automation of biogas production so that it can be sustainable. We've noticed that there's a lot of challenges in the lakeside because water hyacinth, there's no use for water hyacinth, so it's affecting the people. So we have come up with an automated biogas plant which can use water hyacinth to produce biogas, which can assist in increasing the renewable energy capacity of Kenya. Yeah. And also reduce deforestation.
Using hyacinth?
Yeah, using hyacinth to produce biogas. Okay. Yeah.
Maura, if you allow me, let me sample one also here. If you can give me space, you can just stop there. Also, we have this student here also. We don't know what is this, and maybe what are you aiming to solve in terms of Kenyan problems?
Okay, good morning everyone. I'm Shedrack Matata. I'm a first-year student of engineering. Okay, with me here is a gadget that basically the thing is flood detection and warning system. Yeah, majorly I'm intending to solve a problem that I was witnessed last season. Let's say early this year, we had so many lives which are lost as a result of flooding.
So is it detecting floods before, after, or when it's about to happen?
Okay, this gadget will monitor the level of water as it rises up a given dam or river. So it will be able to warn when it's about 10 minutes to flooding. It will be warning. Nasema, let's say it's 10 minutes towards flooding. Okay. Yeah. Then once the flooding has occurred, it will be warning in form of a danger signal. The flooding has occurred, and it will be printing some messages like block affected roads, send rescue teams to this given area, it has flooded. Okay. And when the level goes down, it also starts showing that the flooding has stopped. Yeah.
Thank you.
Thank you.
Wahiga, maybe if I can go back to the interesting story that you really introduced earlier. I'm talking to a young man here who has just come up with a device or a way, innovated a way of maybe helping those, especially patients living with HIV and AIDS, from maybe taking drugs each and every day. If you can come closer to me here, and maybe if you do you have that device, can you have a look at it? And what is all this about, this innovation you have come up with today? If you can give us a brief.
Okay, it's a prototype of a subdermal implant which you shall use for administration of antiretroviral medication. If you can have a look at it, it's here. So this device, this is just a prototype where we intend to use it to deliver daily doses of antiretroviral medications, and thus we reduce the need for daily oral pill, which is associated with reduced compliance, and thus the patient does not really take the medications per need. So with this, once implanted, the patient is off tabs for 6 to 9 months, and then after that period we come replace the implant and it goes on. So
this is a patient suffering from HIV or cancer, or what type of disease?
For now we are targeting patients suffering from HIV and AIDS. Yeah.
Okay. Thank you very much, Maura. Maura, I don't know whether Maura we still have time. We have this guy who has also come up with an innovation of administering of liquids, especially in patients. In 1 second, what is this that you have come up with, your innovation today?
My innovation today is a gadget that uses laser fluorescent technology and bioimpedance technology to detect the level of fluid in a patient so that we don't expose patients to fluid overload. We have realized that management of patients with fluid overload is a bit more expensive, and it's also deleterious in that it leads to even death in some circumstances. So this device will assist patients and also assist healthcare providers that they do not have to be there to monitor patients who have IV fluids. Yeah.
Thank you very much, Wahiga. And it's not only all that, because this expo today, it has really made so many people, especially those who are in health sector and stakeholders, especially in all innovations, they are here to ensure that they also chip in. And like you see, we have a doctor here who is interested in some of this innovation. Dr. Ruto, maybe what is your take on these innovations, and why are you so much interested going ahead with it?
Yeah, as the players in the field of healthcare, we have been looking at these innovations, and the problems that you're having in healthcare are here in Kenya. And we're getting here medical students who are able to develop solutions for those problems. So we've come in as industry players. We've brought in Kenya Association of Manufacturers, Kenya National Chamber of Commerce, so that we can convert what the students are doing into the market. We are looking at taking these healthcare solutions from Kenya here, from Africa, to the global market. So today we have brought investors who are going to invest. We are going to invest in research and development to see that the projects that students are having here are going to the global market.
Whatever you have seen in this project, especially these innovations today, are they workable, and how good are they, and how are they going to solve these problems, especially in our hospitals?
Yeah, definitely. You see the idea of our fifth-year student, Brian, he's come up with a subdermal implant for HIV. You see patients, they take drugs every day, and that's a problem in terms of adherence. So if that solution is going to work, we're going to get patients who will be given an implant. They go for a period of 1 year. It's also another interesting field in terms of prevention of HIV, that those people who are at high risk of getting HIV, recently we've heard about a drug that is able to prevent acquisition of HIV. So if you're able to put that drug into that implant and give it to those people who have high risk of getting HIV, it's going to be a perfect solution. Just from here, from Moi University, from Eldoret here, from Kenya. It's a fantastic idea. And the industry players are here, the manufacturers are here. We are ready to partner with them in research and development and in converting these products to the next level. So this is what we are doing for our country. And it's going definitely to capture the issue of what we are doing now, the big four: manufacturing and affordable healthcare. Okay. Thank you.
Thank you very much, Maura. Because of time, we would have liked to talk to more other, especially stakeholders who are going to play a major role in these innovations today. But Maura, as you remember, Kenya, as per now, is rated number 53 out of 142 countries that are in the World of Economic Forum. And this in terms of innovation, Maura, and hoping that such innovations that have been maybe major solutions to Kenyans are going really to help Kenyans, and see that these students who are coming up with these good innovations are going to a next level. And today, Maura, is a total different day, as I've told you, in this, because most of people from different stakeholders are here trying to wait and see what are these students going to maybe come up with, and maybe they are praying and hoping that it will be going to a next level, not just as normal as usual, the way we normally see good innovations, but they don't go anywhere. But their prayer today is that these innovations will be taken seriously by the government, and they will see these students maybe taking these innovations even to other countries, especially like international countries, for a better market. From Uasin Gishu County, here, Moi University, back to you, Maura.
Thank you so much.